Nuclear energy is often associated with power generation, weapons and industrial applications, but one of its most impactful contributions has been in the field of medicine. Over the last century, nuclear technology has revolutionized diagnosis, treatment and research in healthcare, offering innovative solutions to detect diseases, treat life-threatening conditions, and improve the quality of life for millions of patients worldwide. The medical use of nuclear energy is grounded in the principles of nuclear physics, where radiation and radioactive isotopes are harnessed in highly controlled ways to interact with biological tissues. Unlike fossil fuels or mechanical energy sources, nuclear energy can penetrate the human body and target specific structures, making it invaluable for imaging internal organs, monitoring biological processes, and destroying harmful cells with precision. The foundation of nuclear medicine lies in the use of radionuclides, which are unstable isotopes of elements that emit radiation during their decay. These emissions, which include gamma rays, alpha particles, and beta particles, can be detected or directed to serve medical purposes. Diagnostic nuclear medicine focuses on tracing these emissions to build images of internal body systems, while therapeutic applications harness radiation to kill or modify diseased tissues. Both branches are carefully regulated to maximize health benefits while minimizing exposure risks. Today, nuclear medicine is an interdisciplinary field combining physics, biology, chemistry, and engineering, and it continues to expand through research and innovation. One of the most important medical contributions of nuclear energy is in imaging and diagnosis. Techniques such as positron emission tomography, PET, and single-photon emission computed tomography, SPECT, rely on radioactive tracers introduced into the body. These tracers are chosen based on their ability to bind to specific tissues or metabolic processes. For example, fluorodeoxyglucose, FDG, a common tracer in PET scans, mimics glucose and accumulates in tissues with high metabolic activity, such as cancer cells. By detecting the gamma rays emitted from FDG, doctors can visualize the location, size, and spread of tumors. This level of precision allows for early cancer detection and accurate staging, which is critical in designing treatment strategies. Similarly, SPECT imaging uses gamma-emitting radionuclides like technetium-99m to create three-dimensional images of organs, such as the heart, liver, and brain. These techniques have been especially important in cardiology, oncology, and neurology, helping to diagnose coronary artery disease, Alzheimer's disease, and epilepsy. Technetium-99m deserves special mention because of its central role in nuclear medicine. It is the most widely used medical radioisotope, accounting for millions of diagnostic procedures annually worldwide. Its short half-life of about 6 hours and its ability to emit gamma radiation without producing harmful beta emissions make it ideal for patient safety and effective imaging. By labeling molecules with technetium-99m, doctors can investigate functions as diverse as bone metabolism, renal filtration, and thyroid activity. Beyond imaging, nuclear energy also plays a critical therapeutic role in treating diseases. Radiotherapy, one of the most common cancer treatments, uses high-energy radiation to destroy malignant cells. Unlike chemotherapy, which affects the entire body, radiotherapy can be localized to target only the tumor, reducing harm to surrounding healthy tissue. The principle behind this lies in the sensitivity of rapidly dividing cancer cells to radiation, which damages their DNA and prevents replication. Modern radiotherapy uses techniques such as external beam therapy, in which linear accelerators direct radiation at tumors, and internal brachytherapy, where radioactive sources are implanted near or within the tumor. The use of isotopes such as iodine-131, cesium-137, and cobalt-60 has been instrumental in these procedures. Iodine-131 has a unique role in treating thyroid disorders, including hyperthyroidism and thyroid cancer. Because the thyroid naturally absorbs iodine, radioactive iodine can be administered orally, allowing it to accumulate specifically in thyroid tissue. Once inside, its beta radiation destroys overactive or malignant cells, offering a highly targeted treatment that minimizes side effects. This has been a game-changing therapy, providing a non-invasive and effective alternative to surgery for thyroid conditions. Other cancers treated with nuclear medicine include prostate cancer, where radioactive seeds containing isotopes such as palladium-103 or iodine-125 are implanted directly into the prostate gland, providing localized radiation over time. Nuclear energy has also found applications in pain management and the treatment of non-malignant conditions. For example, radioactive isotopes are sometimes used to relieve bone pain caused by metastatic cancers, strontium-89 and samarium-153, when injected into the bloodstream, target bone tissues with high turnover, which often coincide with areas affected by metastases. By delivering radiation directly to these sites, they help alleviate pain and improve patient quality of life. Similarly, radiosynovectomy, a procedure that uses radioactive isotopes such as yttrium-90, can be employed to treat chronic joint inflammation in conditions like rheumatoid arthritis, offering relief when conventional therapies fail. The application of nuclear energy in cardiology has been equally transformative. Nuclear cardiology relies on imaging techniques to assess blood flow and heart function. Myocardial perfusion imaging, which uses technetium-99m or thallium-201, allows doctors to detect areas of the heart muscle that are not receiving adequate blood supply due to blocked coronary arteries. This non-invasive test helps guide interventions such as angioplasty or bypass surgery, preventing heart attacks and improving outcomes. Furthermore, nuclear imaging techniques are used to evaluate cardiac function in patients undergoing chemotherapy, helping to monitor potential side effects of drugs that may harm the heart. In neurology, nuclear medicine plays an indispensable role in understanding and treating brain disorders. PET scans using FDG can measure brain metabolism and detect changes associated with conditions such as Alzheimer's disease, Parkinson's disease, and epilepsy. By observing areas of abnormal glucose consumption in the brain, doctors can diagnose these conditions at earlier stages and monitor disease progression. Epilepsy patients, for example, may undergo nuclear imaging to identify the precise area of the brain responsible for seizures, guiding surgical interventions. Infectious diseases also benefit from nuclear technology. Radiolabeled white blood cells or antimicrobial peptides can be used in imaging to identify sites of infection or inflammation that might not be visible with traditional imaging techniques. This approach helps in diagnosing conditions like osteomyelitis, abscesses, or prosthetic joint infections. The precision of nuclear techniques enables physicians to detect infections earlier and more accurately, which is crucial for effective treatment. Another significant contribution of nuclear energy is in sterilization and safety. Radiation is widely used to sterilize medical equipment, including syringes, implants, and surgical instruments. This process ensures sterility without the need for heat or chemicals which might damage sensitive materials. Blood products can also be irradiated to prevent graft versus host disease in immunocompromised patients, ensuring safer transfusions. These applications are not directed at curing illnesses directly, but are vital in supporting overall healthcare safety and effectiveness. Research and innovation continue to expand the role of nuclear energy in medicine. Targeted radionuclide therapy, TRT, represents one of the most promising developments. In TRT, radionuclides are attached to molecules that specifically target cancer cells, delivering radiation precisely where it is needed. For example, lutetium-177 has shown remarkable results in treating neuroendocrine tumors and prostate cancer when linked to targeted molecules. This personalized approach to therapy offers the potential for highly effective treatments with fewer side effects. The field of theranostics, which combines therapy and diagnostics using the same radiopharmaceuticals, is also growing rapidly. The illnesses treated or diagnosed through nuclear medicine are vast and encompass nearly every organ system. Cancer in its many forms remains the largest field, but thyroid disorders, cardiovascular disease, brain disorders, infections, bone diseases, and autoimmune conditions all benefit from nuclear technologies. As populations age and the burden of chronic diseases rises, the role of nuclear medicine will become even more critical in meeting global healthcare needs. Of course, the use of nuclear energy in medicine comes with challenges and disadvantages. Radiation exposure, while carefully controlled, always carries a small risk of harm. Patients and healthcare providers must balance the benefits of diagnosis or treatment against potential risks, particularly in vulnerable groups such as children or pregnant women. Additionally, the production and supply of medical isotopes depend heavily on nuclear reactors, which are limited in number worldwide. Disruptions in isotope production can cause shortages, delaying critical procedures. High costs associated with nuclear imaging equipment, Isotope production and facility maintenance also limit access in developing countries, creating inequalities in healthcare. Despite these challenges, the advantages of nuclear medicine far outweigh its disadvantages. The ability to non-invasively visualize the inner workings of the human body, to target and destroy disease cells, and to provide relief for patients with chronic conditions is unmatched by other medical technologies. Furthermore, ongoing research continues to improve safety and efficiency, with innovations such as cyclotron-based isotope production, reducing reliance on aging reactors, and advanced imaging systems, lowering radiation doses.